Hello, my name is Natalie Nicholas, and this is my population-level health education intervention presentation for NURS 447 for community health nursing and case management. So my topics that I am focusing on are substance abuse and mental health disorders. Substance abuse leads to health issues related to the spread of HIV and hepatitis C through shared needles used for injected drugs. Also, it contributes to cardiovascular dysfunction, such as dysrhythmias and heart attacks, as well as gastrointestinal complications, such as ulcers from large alcohol consumption. Substance use exacerbates mental health disorders and compromises safety by putting them in situations for potential harm due to altered mentation and incoherent judgment. So within the city of Hemet, the median household income is about $35,609, which is less than the median household income of California. Financial security places a lot of stress on many of the people living in poverty or low income, which can lead to unhelpful coping strategies such as substance abuse. Also, prolonged stress can cause symptoms of depression. Among the numerous amount of homeless population, 15.2 million youth are homeless in a given year, which contributes to impeding their physical, psychological, and emotional growth. One of the main issues with the occurrence of drug use is that it occurs during adolescence or early adulthood, and it becomes a very difficult habit to get rid of. Because there is such a large population involved in substance abuse, because it is easily accessed. Drug users often report their initial desire to try drugs, which is affiliated with other users. In the Healthy People 2020 objectives for substance abuse and mental health and mental disorders, it states to reduce substance abuse to protect the health and safety and quality of life for all, especially children, increase the proportion of persons with co-occurring substance abuse and mental disorders who receive treatment for both disorders, and increase the proportion of homeless adults with mental health problems who receive mental health services. So the need and priorities of self-care diminish as substance use becomes the main priority in their lives. With the alteration of these substances, they put themselves in harm by using and not having the capability of safe reasoning. So in the windshield survey, I saw many homeless people ranging in ages from adolescent age to young adults, mostly living in parks, especially Weston Park. There are many, there's streets littered with alcohol bottles, needles, and syringes. I observed homeless people with psych issues, talking to themselves, hallucinating, and I obtained information through survey of yes or no questionnaires about substance abuse and mental health disorders within the surrounding neighborhood and were given to the employees at the hospital. What got me interested in choosing the topic was how I noticed many drug-related admissions we were receiving in the hospital and how many of them were homeless and had been previously diagnosed with mental health disorder. In my precede-proceed model, I observed and collected demographic data by obtaining interviews and distributing questionnaires to the community. With this, I identified factors contributing to health-related issues. I chose to present to a church youth group and adult group, seeing as how this age population is greatly affected. The impact of teaching was evaluated, and seeing as how many interactive questions there were even with the youth group, it made it evident that this was a relevant issue to many of these people. Finally, identified long-term goals and expected outcomes from the teaching. Requirements to reduce effects of the problem are readiness and willingness to change and accept further intervention. This includes willingness to achieve sobriety through a rehab center or taking steps toward making safer choices to prevent mortality. However, some people may not be able to give up the one coping mechanism that they have been dependent on. Then there's the ability to acquire new coping mechanisms and interventions to deal with stress. and adherence to medications and understanding significance. In the presentation I taught for the youth group and adults at the Sanctuary Church in Paris, California, I elaborated on interventions addressing Healthy People 2020 objectives, which is to reduce substance abuse and protect quality of life for all, especially children, and to increase the proportion of persons with co-occurring and substance abuse and mental disorders who receive treatment for both disorders. There is a treatment center called Hemet Valley Recovery Center and Sage Retreat that provides programs for individuals to achieve sobriety, and it helps to address the mental health disorders that they may have. This program allows families to work together in helping loved ones battling through addiction, which is considered a mental health disorder as well. For those struggling with homelessness or poverty, the Valley Restart Center provides housing and job placement for those attempting to get their lives together while battling addiction. There are stages, however, of readiness in achieving long-term goals, and even if people do not want to quit using these substances, they can reduce the risks of mortality. The spread and transmission of blood-borne pathogens or even cellulitis can be reduced by using clean needles through the Clean Needle program. The program provides sterile needles, syringes, sharp disposals, information and education for those who use injection drugs. Unfortunately, accidental overdoses can occur multiple times with opioid drug users. Now, naloxone or Narcan, which is an opioid reversal agent, is now available in the form of a nasal spray and is available over the counter in 46 states, including California. Substance abuse is a form of a coping mechanism. It is important to recognize the source of stress and compile a list of self-care and coping strategies that facilitate a better quality of life. So in addressing a budget, if this class were to be replicated, the budget to be considered may not be supplemented. There is a cost and availability of the venue unless the community volunteers a location at no cost. The cost of classes would have to be very low to accommodate low income or be subsidized by Medicare or Medi-Cal, which is highly unlikely. There are minimal costs such as printing for handouts and pamphlets that may cost about $5 to print depending on the amount of people who are expected to attend the class. And lastly, the training requirements would be for an RN, PHN with a minimum salary of $30 an hour. So with the project evaluation and outcome measurement, the outcomes were met in that it did help increase awareness of substance abuse and mental health disorders. It provided information of prevention and deterrence of substance abuse by identifying alternative coping mechanisms and the ability to know there are other options available to aid in overcoming addiction and safety during consumption of substances. Results and conclusions. The overall message and goal was to increase awareness of mental health illness in the community and educate about substance abuse to prevent and deter the community in participating in it. It is useful as preventative and educational methods to inform the community that these issues are real and prevalent in their community. They are able to get a better idea of how the issues are intertwined and how substance abuse affects one's mental health. It can help people who have family and friends dealing with these issues better understand and talk them through their situation. Therefore, the intervention worked by achieving the goals and outcomes. If I were to do this project again, I would like to involve more creative, interactive activities to help promote interaction within the community and build more rapport and support within the community as well. And these are my references, and that concludes my presentation. Thank you.